Today's lecture focuses on suicide assessment and nursing management. By the end of this lecture, you should be able to identify populations at highest risk for suicide, distinguish myths from truths, recognize warning signs, describe appropriate nursing interventions, and explain management of a suicidal patient in the acute hospital setting. Suicide is defined as the act of taking one's own life voluntarily and intentionally. It is both a civil rights issue and a medical and ethical issue. In our society, suicide is generally viewed very negatively, yet it remains a major public health concern. Let's review important facts. Suicide is the 12th leading cause of death in the United States. It is the second leading cause of death among adolescents and young adults. More people die from suicide than from homicide. For every completed suicide, there are at least 12 attempts. It is very important to understand that thinking about suicide does not automatically mean a person will act on those thoughts. However, anyone who talks about suicide, threatens suicide, or attempts suicide must always be taken seriously. Substance abuse is one of the strongest risk factors. Now consider this scenario. Which individual is at highest risk for suicide? A teenager breaking up with a girlfriend, a young mother whose child is very ill, a white male with a long history of alcohol abuse, a 55-year-old married woman with pancreatic cancer. The highest risk individual is the white male with a long history of alcohol abuse. Statistically, white males with substance abuse histories have the highest suicide completion rates. Now let's discuss causes and risk factors. The primary psychiatric risk factors are major depressive disorder and substance abuse disorders. Other psychiatric conditions that increase risk include anxiety disorders, bipolar disorder, and psychotic disorders. Suicide pacts are sometimes seen among teenagers. Copycat suicides may also occur, particularly in adolescence after media coverage of a suicide. Emotional contributors to suicide include hopelessness, shame, guilt, humiliation, and isolation. Hopelessness is especially important. When patients believe their situation will never improve, suicide may feel like the only option. Now consider assessment. Which question is least crucial when assessing suicide risk? Have you ever thought about suicide? Do you have a plan? How many children do you have? Who makes up your support system? The least crucial question is how many children the patient has. While family information is important, direct assessment of suicidal thoughts and plans is far more critical. When assessing suicide risk, always ask directly and clearly. Asking about suicide does not plant the idea in the patient's mind. In fact, it often provides relief. Now let's review methods. The most common methods of suicide are firearms, hanging, and overdose. Men are more likely to use firearms or hanging, which have higher lethality rates. Women are more likely to attempt overdose. Access to lethal means significantly increases risk. Now let's identify warning signs. Verbal threats such as, "I wish I were dead," or "You won't have to worry about me much longer." Expressions of hopelessness. Prior suicide attempts, which are one of the strongest predictors. Risk-taking behaviors, talking about suicide or death. Access to lethal methods. Behavioral warning signs may include giving away personal belongings, cleaning house, choosing a special friend to receive meaningful items, or becoming preoccupied with death. One particularly dangerous sign is a sudden improvement in mood after severe depression. This may indicate the patient has decided to complete suicide and feels relief. For example, a patient who has been severely depressed for weeks suddenly appears calm and cheerful after making final arrangements. This should raise immediate concern. Sleep disturbances are also common. Difficulty sleeping or drastic changes in sleep pattern may signal worsening depression or agitation. Now, let's discuss treatment. Suicidal patients require emergency psychiatric care. Treatment focuses on the underlying disorder, such as depression, bipolar disorder, psychosis, or substance abuse. Suicide hotlines are valuable resources. Many individuals who think about suicide are ambivalent. They may drop hints hoping someone will intervene. A safety plan should be developed with the patient, family, and support system. This includes identifying warning signs, coping strategies, and people to call during crisis. Now let's review nursing interventions. First and foremost, anyone who threatens or talks about suicide must be taken seriously. Use honest and direct communication. Ask questions such as, are you planning to kill yourself? How would you do it? When are you thinking about doing this? These questions assess intent, plan, and lethality. In a hospital or facility, suicidal patients are monitored closely, often every 10 to 15 minutes, or continuously if risk is high. Identify and remove means for self-harm whenever possible. Maintain safety for the patient, yourself, and others. Suicide precautions in a facility include removing all potential weapons. This includes knives, silverware, pens, glass containers, belts, shoelaces, bedlines if necessary, and electrical cords. Staff must be notified of suicide risk. Patients should be placed close to the nursing station for observation. Unsupervised visits are not appropriate during acute suicide precautions. If asked which should be part of suicide precautions, the correct answer is moving the patient close to the nursing station and notifying all staff of the suicide risk. Medication administration requires careful observation. Ensure the patient has swallowed medication and is not pouching or saving pills for later overdose. Finally, we must consider family survivors. When someone dies by suicide, loved ones are at high risk for prolonged grief, guilt, anger, and emotional distress. Support and counseling are often necessary. In summary, suicide is a major public health issue and psychiatric emergency. Depression and substance abuse are primary risk factors. Warning signs must never be ignored. Direct assessment saves lives. Nursing care focuses on safety, monitoring, communication, and treatment of underlying mental illness. Early recognition and intervention are critical